Hello, I'm Michael A. Weiss. Welcome to the Crohn's disease 2-minute drill. The play for today is surgery and Crohn's disease. Why surgery? I mean, let's face it, the medications don't cure Crohn's, so why would you go and have pieces of your intestine cut out when you know that it doesn't cure the illness? Well, sometimes you have no choice. It's an emergency. What do I mean by that? Look at your intestines like a garden hose. When there's a kink in a garden hose, the water can't get through it. It stops up there. Well, when you have so much inflammation in your intestine, it could be from your Crohn's disease, it could be from adhesions, it could be fistulas, whatever. Nothing passes through, and your body has a natural process of moving things along called peristalsis. It keeps pushing, and if it keeps pushing, something's got to give. That something is your intestine, so you could push through the intestinal wall, perforate the intestine, and go out into your body. And then you got a serious infection and you need emergency surgery for the most part. So that's kind of why, and what we call that is an obstruction or a blockage. It could mean many things. It could be because of many things. Like I said, infections, fistulas, abscesses, etc. But that's why you would have surgery. And also, your Crohn's disease may get so bad, like it's not responding to medication, that the inflammation is so great that it causes a blockage that doesn't respond to medication. That happens often. People sometimes ask about laparoscopic surgery. You know, a lot of people have knee surgery and the doctors make like two little holes. They go in and you're playing ball in like 2 weeks. With Crohn's disease, the surgery is pretty complicated. I believe there are doctors who do certain types of procedures or surgeries laparoscopically, but for the most part, they cut you from here down to here, cut you open, and also they have to kind of take your intestines out and run them through their fingers so they can feel the texture of your intestines. I don't know if every surgeon does that, but I've heard of surgeons who do. It's a really good method of finding out where you may have Crohn's disease beginning or where it may be, but it's not bothering you. So they have to look at it now because they don't want to have to cut you open 3 months from now because the texture is a giveaway. Then, of course, there's something called adhesions. Adhesions is scar tissue. And anytime you have your stomach cut open and they operate on you, no matter how successful the surgery is, from that second on, as it heals, adhesions are going to grow out of it. Sometimes the adhesions could be extremely dangerous because as they grow, they attach to different loops of bowel. And you have to have it operated on so they could cut or lance or lice, whatever the phrase is, to cut the adhesions out so that you have a normal digestive system. Why would you not have surgery? The main reason is that with Crohn's disease, they find that the illness recurs. So you could have surgery in February and feel great, but then in June, right around where the parts are where they connected it, you could have problems again. It's happened to me many, many times. I can't tell you how demoralizing it is to feel great and then to start to feel that same pain again and then to go back into the hospital. There are different types of surgeries when you go in for Crohn's disease surgery. There's the basic resection, which is like plumbing. They take out the diseased part and they reconnect it. That's pretty basic. Then there's something called a strictureplasty. It's complicated to explain, at least for me, but you really don't lose much intestine. They sort of flatten out the intestine and they're able to connect it by taking away the diseased part. I really can't explain it, but it's called a strictureplasty. So you have resections, you have strictureplasties, and obviously they correct fistulas. And then there's several other types of Crohn's disease surgeries that are more particular to the area of your body where you have the Crohn's disease, your colon, your large intestine, etc. And with that, we have just completed the Crohn's disease 2-minute drill, where the play was surgery and Crohn's disease.